Hello and welcome to ESG 300 Entry, Exit, and the ESG Assessment. I'm your trainer, HMIS System Lead Trisha Kano. The HMIS team calls this training ESG, which stands for Emergency Solutions Grant, because it's short and easy to remember. But please be aware the focus of this training is how to collect and document data in HMIS for rapid rehousing and/or homeless prevention projects. Rapid Rehousing is a program that provides financial assistance and services to prevent individuals and families from becoming homeless and to help those who are experiencing homelessness to be quickly rehoused and stabilized. Homeless prevention is a set of strategies to help low-income households resolve a housing crisis that would otherwise lead to homelessness. We will go step by step on how to correctly enter a single or a family into your project and complete the ESG entry assessment as well as the Maricopa UDE assessment. Both of these assessments include information such as demographic data, as well as income, benefits, health insurance, and disabilities. We will also work through how to complete an exit on a client or a family and the ESG exit assessment today. Please note that if you have any questions, please feel free to contact the help desk via email at hmiSsupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log into HMIS or Service Point, and you should have learned this in the HMIS 100 class, for most rapid rehousing or homeless prevention projects, you will be required to get into Enter Data As mode. If you go to the upper right-hand corner underneath your name, find the link that says Enter Data As and click on it. And here you'll be given a list of projects that you have access to. In this case, a homeless prevention or a rapid rehousing project. I've kept this list short and sweet for training today, but please keep in mind that you may have a much longer list to choose from, and please choose the appropriate project. For training today, I'm going to enter Data As into the ESG grant for Rapid Rehousing City of Glendale. To choose the appropriate project, find the green plus sign next to their name and click on it. Now you'll notice up in the right-hand corner next to Enter Data As, it now has the project that I am entering data as listed. The next thing you need to consider before starting your entry of a new client into the system is, do you need to be in backdate mode? Did your interaction or did your enrollment with the client happen today, or did it happen sometime in the past? Which is often the case, especially for rapid rehousing. So if it did not happen today, then you should get into backdate mode to the day that it happened. So again, in the upper right-hand corner under your name, under Enter Data As, there's a link called Backdate. Click on that, and here's where you can change the date to the day that you actually had the interaction with your client or the day they actually entered or enrolled into your project. So I'm going to clear out the day that's there, and I'm going to backdate to when my client entered. So for demonstration purposes today, I'm going to use the date of 10/5/2015, going way back in time so that we can demonstrate what happens over time with the client. But please keep in mind that the HMIS data quality plan says that all data on clients should be entered within 5 business days. So once you have your date filled in, just click Set Backdate, and your banner will turn bright yellow, and it will remain yellow as long as you're in backdate mode. Okay, now we're ready to look up our client in the system. If you're working with an individual, go to the menu on the left and click on the button that says Client Point, and you would just look up that individual in the system. However, if you're working with a family, be sure that the individual you're looking up is the head of the household. I will be using a family today for demonstration purposes because it's a little more complicated, but I will point out the differences between families and individuals as we go. So let's look up our client. I'm just going to put a test client in the system. Go ahead and fill out all the information on the search screen because if this client is new to the system, you're going to have to complete these questions anyway. So we put in the name of the client. Then what is their name data quality? Is it full name reported, partial street name or code name, client doesn't know, client refused, or data wasn't collected? It's usually one of these two. The partial or street names is usually used in outreach teams. So I'm going to say full name was reported. And then you have a place to put any aliases if applicable. Then we have social security number. What is the client's social security number? If you do not have their social security number or they refuse to give it to you, please just leave these blank. Don't put all zeros or all ones. Leave it blank. And then choose your social security number data quality. Was the full social reported? Was it an approximate or partial social? Partial means, for instance, they just agreed to give you the last four, which is fine. The client doesn't know their social, the client refused to give you their social, or the data was not collected. And keep in mind, wherever you see data not collected, that means that you, the interviewer, did not even ask for that information. I will say full social reported. And then finally, is this client a U.S. military veteran? Yes or no? There is also an exact match box. Please do not check this because what will happen is the system will only search for clients with this exact information. And you want to see if someone has the same name but it's just misspelled, or maybe the social security number is only off by one number. You want to get a lot of results so that you don't accidentally create duplicates. So please do not use exact match. Once this information is filled in, click your search button to look for this client in the system. And what will happen down below under client results is you'll get a list of clients who closely match the client you're searching for, or is that client you're searching for if they've already been in the system. If you see your client on the list down here below, then you would just click on their name or the pencil next to their name to open up their existing record. Please use their existing record if you find them on the list. We don't want to create duplicates. If you see a client on the list and it's close but you're really not sure, then go ahead and create another client. And if we discover in the future that it was the same person, you can contact the HMIS help desk and we can easily merge those records together. But as you can see, in this case, I have no matches under client results. So that means my client has never been in the system before, and I'm going to have to create a new record. So go to the button that says Add New Client with this information and click on it. You're going to get a warning asking, did you really thoroughly search and are you sure you want to add a new record? So then click OK. Once you click OK, the system will take you to the Client Profile tab on the client record. And this is where you default whenever you create or look up a client record. Before I go into actually how to create the entry for your client or your family, let's talk a little bit about the different sections that you're seeing and the different tabs and what they all mean from the client record. This first section called Client Record is where you have like their name and their social and their veteran information. If you needed to edit this information because the name was spelled wrong, or now you have their full social, or you forgot to answer the veteran question from the search screen, you can click on this pencil next to Client Record to edit any information. Name, social, veteran. So keep in mind the veteran question can be answered either from the client search screen or from the client record. On the right, you can also upload and attach a client photo to the record if needed. Underneath client record is the client demographics section. You'll notice it's blank right now. It always looks like this for a new client because we haven't completed their assessment yet. As soon as we go to the entry exit and we complete an assessment on them, this information will auto-populate. Please do not ever fill in the client's demographic information from this screen. Always do it through the Entry Exit tab, and it will automatically update here. Then we have an area for a custom assessment, and for most projects, this is where we put the AZ Client Notes feature, though your project may look slightly different. Keep in mind, if you want to know more about AZ Client Notes and how to add them, that's in the Case Management 200 series of classes. Then we have a very generic client notes section, and most projects don't use this, but talk to your supervisor. Then we have file attachments. This is where documents can be scanned and uploaded and have an electronic copy saved in the database. This is for things like birth certificates, ID cards, and releases of information. And then finally, we have the incidents. This is where everyone who works at your agency can be on the same page about what sort of incidents may be happening with this client. Sometimes it has to do with non-compliance with rules, or they've exhausted their stay, or it can even be a positive like, hey, so-and-so needs to meet with their case manager as soon as possible. Let's scroll back up to the top and talk about the tabs. Next to the client profile is the Households tab. If you're working with families, this is where you're going to group the people in that family together, or couples. If you're working with a single, you don't need to do anything on this tab. We'll come back to this in a minute. Next to Household is the Entry Exit tab. This is where you're going to spend the most time. This is where you create your entry, fill out all your assessment data, and then create your exits down the road. Next to the Entry Exit tab is the Case Managers tab. This is where you can assign yourself as this client's case manager. This is covered more in the Case Manager 200 series. Then you have Case Plans tab. This is where you can add goals or an electronic service plan for a client. This is also covered in the Case Management 200 series. And then finally at the end here we have the Measurements tab. And this is where, if your project uses the SPDAT or FSPDAT case management tools, this is where that information is inputted. And then behind Case Managers is a Service Transactions tab. And this is where all services and/or referrals are recorded on the client. Clients receiving services from Rapid Rehousing or homeless prevention projects do need to have those services recorded in HMIS, and we will be showing you how to do that in the ESG 302 class. Now let's go back over to the client information and back to the client profile tab so that the record looks just like it would have looked when you first looked them up or created them. Okay, so let's actually enter our new client into the project. As I stated earlier, we'll be working with a family today, so the first step is I have to create my household group before creating the entry. So click on the Households tab, and I will show you two examples. The first example is when you have a client with no established household, and you have to start one from scratch. So click the Start New Household tab button. Select the household type. Is it a couple, parent and friend, and children? A couple with no children, extended family unit, foster parents with children, grandparents with children, non-custodial caregivers with children, other, single parent with children, or two parents with children. And keep in mind the difference between a couple, parent and friend with children, and two parents with children means that, okay, so two parents with children means they're either married or they have at least one common biological child. I got it out. This just means that there's a couple and there's children, but they don't have any shared biological children. So for training today, let's just use single parent with a child or children. And then this client search area, which should look familiar to you, is where you're going to look for everyone else in the family. So if this was a couple, this is where you would look for, the husband or the wife and then all the children. So I'm going to look for this client's child, and I'm going to say the full name was reported, but I'm going to say the client doesn't know the child's social security number right now. The U.S. military veteran question doesn't even need to be answered for children that are under 18, but you can put no, it won't hurt anything. And then do a search for this child. Then you would go down here under client results and see if this child showed up. Have they been in the system before? And if their name does populate, then you would choose them by clicking a green plus sign. But since I have no matches, that means this child has never been in the system and I need to create a new record for them. So I will go up and click the Add New Client with this information button and confirm. And then look, the child is dropped down into the selected clients area with my head of household. You would continue to do this, searching for each person in the household until everyone in the family was listed below, no matter how large that family is. For training today, I'm just going to keep it at this head of household and their child. So once you're done, click the Continue button in the bottom right corner. And now we have another step to do where we have to designate which of these clients is the head of household, and only one person can be the head of household. So find that parent and go to the head of household column and change the no to a yes. When you do that, the relationship to the head of household automatically defaults to self, and this is correct. Then you're going to designate the relationship of everyone else in the family. In this case, I'll say this is her daughter. And then check your joined household date. This date should be their entry date into your project or earlier. It should never be after their entry. If everything looks correct, that's all you need to do, and you click Save and Exit. And now you have a household created. Now I just want to show you another scenario really quick. If for some reason you were using a client that was already established in the system and they already had a household, so you'd go to the Households tab and look, there's already a household created. In this case, we want you to use that same household if at all possible. So you will look at the household, review it, make sure everything is still correct. If something is incorrect, you can fix it. So let's say, for instance, this family, this was a husband and wife and one child. But let's say time has gone by and now the husband and the wife have separated and there's another child. There's two children instead of only one. Here's how you would fix it. Click the Manage Household button. And the first thing I'm going to do is add in the next child. So there's child 1 and I'm going to add another child. So you click this button that says Add or Delete Household Members. And then where it says Add Clients to the Household, expand that section to get a search screen and search for child 2. Remembering to fill out all the information if you know it. There's no matches, so I'm going to add this client to the system, continue, and look, now my family went from 3 people to 2 people. And I have to designate what's the relationship of this child to the head of household, and this is a daughter. Now I also mentioned that maybe they split up. Maybe the husband and the wife are no longer together. You don't have to remove the husband from the household because they might get back together in the future. Just keep in mind when you go to create the entry, you can exclude or include whoever you want into the actual entry. And I'll show you that in a few minutes. However, in this case, the composition has changed because the wife is now seeking shelter or seeking assistance on her own. So we have to change the household type above from 2 parents to a single parent. And we have to change and make the wife the head of household and then change those relationships. This was her husband. Boom. Then click Save and Exit. And now you can use this household when you go to create your entry. Let's go back to our original client. We have our household created that we're going to use in training today. And remember, if this was a single or an individual client, you don't have to click on the Households tab and do any of this. You would just go straight to your entry. So now I will click on the Entry Exit tab, and this is where we will create the entry into your project. Once you're on the Entry Exit tab for your client or your head of household, create your entry by clicking on the Add Entry button in the left-hand side. At the top, you will be able to include the other members of the family if you're working with a family. Remember earlier I said this is where you can decide to include or exclude certain members of the family. If you need to exclude someone who is no longer in the family, you just don't check mark their name. Check marking each name includes them in the entry into this project. Ensure the provider is correct. It's defaulted to the Rapid Rehousing project because I'm in Enter Data As mode. If it doesn't default to the correct project, that means that you're not in Enter Data As mode, and you should cancel and fix that. Select the type. It's always going to be HUD for Rapid Rehousing or Homeless Prevention. And then ensure your entry date is correct. Our entry date has defaulted to October 5th, 2015 because we are in backdate mode. Once you ensure all of this is correct, click Save and Continue. You'll see at the top that you have now created an entry for your client and their child as of October 5th. Underneath that, you have your Select an Assessment area where you can fill out more than one assessment, and we will be completing 2 different assessments today. The default assessment is the Maricopa UDE assessment. UDE stands for the Universal Data Elements. We have to complete this assessment first for each member of the family, because these questions share with other providers in the system. Once we complete this assessment on everyone in the family, then we will switch and do the larger ESG entry assessment for everyone. So let's start with the Maricopa UDE on our head of household. The instructions I give for how to complete this on the head of household will be the same if you're working with a single. So the date of birth, use a 2-digit month, day, and a 4-digit year. And then your date of birth type. Full date of birth reported, approximate or partial date of birth, or the data was not collected. Approximate or partial dates of birth are usually for outreach teams, and in most cases you will record the full date of birth. Then, what is the client's primary race? American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, or the data wasn't collected. If you're not sure what these mean, you can hover on the question, and we have given you the HUD definition of these 5 races. The secondary race is optional. If the client does not report a secondary race, please leave this question blank. Then you have ethnicity. If you're not sure what ethnicity means, hover on the question and you're given the HUD definition. Non-Hispanic, non-Latino, or Hispanic Latino. Then we have gender. Female, male, transgender, male to female, transgender, female to male, other, or data wasn't collected. If you choose other, please type in the other gender reported to you by the client in this text box below. For training today, let's choose female. Does this client have a disabling condition? Again, if you're not sure what that means, you can hover on the question and we've given you the HUD definition. Yes or no? I'm going to say no today. What was the client's residence prior to project entry? This means where did they sleep last night? In an emergency shelter, foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, a hotel or motel paid for without emergency shelter voucher, jail, prison, or juvenile detention facility, long-term care facility or nursing home, owned by client, no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, a place not meant for habitation, which can include the streets, abandoned buildings, encampments, vehicles, things of that nature, psychiatric hospital or other psychiatric facility, a rental by client, no ongoing housing subsidy, a rental by client with a VASH subsidy, and VASH means Veteran Administration Supportive Housing. Rental by client with GPD tip subsidy. This is also a veteran project, grant per diem transition in place. Rental by client with other ongoing housing subsidies. An example of other ongoing housing subsidies could be Section 8, public housing, or another rapid rehousing project. Residential project or halfway house with no homeless criteria. A safe haven, which is a project for SMI or serious mental illness. Staying or living with a family member in their room, apartment, or house. Staying or living in a friend's room, apartment, or house. Substance abuse treatment facility or a detox center. Transitional housing for formerly homeless persons, or for homeless persons, sorry. Other, client doesn't know, client refused to tell you, data wasn't collected by the interviewer. If you choose other, please type in the other type of residence in the text box below. However, this is a very comprehensive list, and using others should be very rare. If you're not sure which option to choose from this list, please feel free to contact the HMIS Help Desk and we will assist you. For training today, let's choose an emergency shelter. Then we have length of stay in this previous place. This directly relates to the question we just answered, emergency shelter. How long did they stay there? 1 day or less? 2 days to 1 week? More than 1 week but less than 1 month? 1 to 3 months? More than 3 months but less than 1 year? 1 year or longer? Let's choose more than a week but less than a month. And then zip code of last permanent address. This is the last place the client resided in housing for 90 days or more. If the client cannot remember the exact zip code of where they lived, we've provided a cheat sheet based on city. They can usually at least tell you the city they were living in, and you can use this zip code. Let's say they were living in Glendale. Please use the correct zip code if you have it. The cheat sheet should only be used when the client cannot remember. Next, we have relationship to head of household. Self or head of household's child, head of household's spouse or partner, head of household's other relation, and head of household's non-relation. So in this case, this is the head of household. If this was a single, you would also choose self, they're the head of their household of 1. Then we have client location. This is the COC code for Maricopa County. There's only one option, so the only way to get this wrong is not to choose it. Homeless primary reason. This is the main reason your client reports to you that they have become homeless. Aged out of foster care, client doesn't know. We've given a client not homeless option, and this is for diversion or homeless prevention projects. Client refused, criminal activity, data not collected, domestic violence, economic, evicted, family dispute, overcrowding, loss of job, medical condition, mental health, move to seek work, natural disaster or fire, release from jail or prison, they've relocated, substance abuse, and trafficking exploitation. If you're not sure what trafficking and exploitation means, you can hover on the homeless primary reason question and we've given you the definition. For training today, let's choose evicted. Then we have the length of time on street in an emergency shelter or a safe haven section. It's very important that all of these questions are answered for every adult entered into the system. This is how we determine, one of the ways that we determine if a client meets the chronic homeless definition. Please do not leave any of these questions blank. Let's get started. The first question is the client entering from streets, ES, or SH? You should answer yes if the client is entering your project directly from either a placement meant for habitation, an emergency shelter, or a safe haven. You should answer no if your client is directly entering your project from any other location. Please note that diversion and homeless prevention should probably always choose no. Now, our client reported coming to us from an emergency shelter, which meets this criteria, so let's say yes. The next question is, if yes, for client entering, approximate date started. So if you said no to entering from streets ES or SH, then you should leave this date blank. The question does not apply. But since we said yes, we must answer it. And they want to know, when did this current episode of homelessness start? You should have the client look back to the date of the last time that they had a place to sleep that was not either on the streets, in an emergency shelter, or in a safe haven. And this date can be approximate. So for example, let's say the client told you their homelessness started around May, but they don't remember the exact day. You can use their current entry into your project to approximate this. So if their homelessness started in May, you can put May 5th because their entry date into your project was October 5th, 2015. The next question is, and this is answered even if you said no to the first question, regardless of where they stayed last night, the number of times this client has been on the streets, in an emergency shelter, or in a safe haven in the past 3 years, including today. So your options are never in 3 years, 1 time, 2 times, 3 times, 4 or more times. Never in 3 years should only be used by diversion or homeless prevention projects. Because they specify in the question that you should include today, it will always be at least 1 time for any other type of situation. The next question is the total number of months homeless on the streets, in an emergency shelter, or a safe haven in the past 3 years. This is the accumulated number of months spent homeless in the past 3 years. This question is very important, and please be sure to answer it. Don't leave it blank. The only exception would be a diversion or homeless prevention client who has never been homeless in the past. You can leave it blank. Otherwise, everyone else should answer this question, including Rapid Rehousing. Even if today is the one and only time they've ever been homeless, you should choose 1 month. This time is the first month. That's because even a partial month, as in 1 day, counts as 1 full month when calculating months homeless. You can see your options are 1 through 12 or more than 12 months of accumulated homelessness in the past 3 years. And then finally, is this documented? Do you have an affidavit? Do you have a referral from a case manager, something like that? It does not have to be documented to put this in HMIS. This is a client self-report. Once you've completed these universal data elements for your head of household or your client, click Save. Don't click Save and Exit because we're not done yet. Just click Save. If this was a single, we would go up and switch to the ESG entry assessment to open it and answer some additional questions around income and benefits. But because we're working with a family, we must now complete the universal data element assessment for every other person in the household. So let's go to this household members list on the left next to your assessment and click on the next person. And in this case, it's this client's child. The child record does not need to be completed as much as the adult record. Please see the handout or the cheat sheet we give you in your training confirmation email that explains which questions have to be answered for which types of clients. So let's complete this child's universal data element assessment. You put their date of birth type, their race, secondary race if they have one, otherwise leave it blank, ethnicity, and gender. You are not required to answer the disabling condition if it's no, but if the child does have a disabling condition, then you should say yes here, and then we will enter the disability type later on. But let's say this child does not have any disabilities, so I can just leave it blank. I don't have to answer any of the prior residence questions for children, but I do have to answer what is their relationship to the head of household. So it'll be head of household's child. And I don't have to answer any of these length of time on street questions for children. So I can go down and click Save. And now the child's universal data elements is complete. Once you complete the universal data elements assessment for each person in the family or for your individual, then we need to switch to the ESG entry assessment. So I'm going to get back on my head of household for if you're working with a family. And I'm going to go up to the Select an Assessment area, and I'm going to switch to my ESG entry assessment. And you see now my assessment has switched. The top of this assessment is just the universal data elements again, and because we've already completed them, the answers to the questions just flow right in. So I need to scroll down to the actual ESG program data elements area. And because I am working with the head of household or the adult, then I need to complete every question. So the first area deals with income. What is their total monthly income? Are they getting any income? And if they are, how much do they get per month? If the client reports not receiving any income, don't leave this blank. Please put a 0. But let's say our client is receiving $500 a month at their part-time job. Then you answer income from any source, yes or no, and in this case it's yes. And then I have to input all the income sources and whether they're receiving them. The quick and easy way to do this is to use HUD verification. Please keep in mind that HUD verification is required of all the federal partners, and ESG is one of them. So to make this really easy, click the red HUD verification, and you can see all the sources at once. There's 15 income source types. But to make this go faster, so you don't have to click yes, no, yes, no, yes, no for all 15 types, there's a shortcut. Up at the top, you can complete a value for every record at once. So if you click no, it'll switch all the sources to no, and then you just change the source that they are receiving to a yes, and they can be receiving more than one. For this example, they have a part-time job, so I'm going to find earned income, and I'm going to change it to a yes. As soon as I change it and click yes, then a pop-up window opens asking for the amount. Just type in the amount we indicated earlier and click Save. Like I said, a client can have more than one income. If they were also getting child support, you could click yes for it and put in the amount as well. Click Save and Exit, and when you do that, there is now a yes or no answer for every income source, and your HUD verification turns green, and this is what we want. The next section is non-cash benefits. These are things like food stamps, WIC, TANF transportation. So is the client receiving any non-cash benefits? Let's say yes, they're receiving food stamps. Use the HUD verification again. Here are the 7 or 8 different non-cash benefits sources that you have to choose from. I'm going to say no to everything except food stamps. And then click Save and Exit. You see when I clicked yes, a pop-up window didn't open. That's because HUD and the federal partners don't need to know the amount of food stamps they're getting, just are they getting them, yes or no. Then we have the health insurance. Is this client receiving any sort of health insurance, yes or no? Let's say the client is on access, so let's say yes. Use your HUD verification link so you can see all the health insurance types at once. There's 8. And let me make a few points. Medicaid is access in Arizona. So if a client reports being on access, you would document that as Medicaid in HMIS. There is an option, state health insurance for adults. Some states have this in addition to Medicaid, but Arizona doesn't. So please don't choose this option. If a client reports something that sounds like state health insurance, it's probably Medicaid. So I'm going to say no to everything, but change Medicaid to a yes, and save and exit. And then my HUD verification is green. And there's 4 of these, so the last one is disability types. This is where I document the disability types. If I had said yes, my client had a disabling condition, this is where I would indicate what type of disabling condition or conditions they have. But even if they have none, I still need to do my HUD verification and say no to each type. There are usually 7 types, but we're in training right now, so one is missing. I apologize for that. If a client does have a disability type, I just want to show you what that looks like. So let's say they did have a physical disability. You would change it to a yes. A pop-up window opens where you have to answer a few additional questions. Is it going to be of long, continued, and indefinite duration? Yes. Do you have it documented on file? Yes, you should. These 2 questions apply to PATH teams only, so you can skip them and leave them blank. And then, is the client currently receiving treatment for this disability? Yes or no. And is it going to be a long term? Yes. And then you would click Save. I'm going to click Cancel because my client reported no disabilities. And you could say yes to more than one. Once you're done, click Save and Exit, and your HUD verification is green. And then we have highest level of education attained. You have your grade school, your high school, and your degrees. Let's say the client received a GED. Is this client a current domestic violence victim or survivor? Yes or no? If yes, when did the last experience occur? Within the past 3 months, 3 to 6 months ago, from 6 to 12 months ago, or more than a year ago. And then also, if yes for domestic violence, are you currently fleeing that situation? Yes or no? Keep in mind, if I had said no to domestic violence victim or survivor, then these 2 questions do not apply and I would leave them blank. And finally, we have the in permanent housing question, and if yes, date of move-in. This pertains to rapid rehousing clients. Usually what happens in rapid rehousing is the client is enrolled in the project and there's a time period where lots of paperwork and housing searches are done. And so they may be entered in the project, but they don't actually move into their apartment or their permanent housing until sometime down the road. So most of the time, right at entry, this is going to be no. But it will be your obligation to go back and update this to a yes and their move-in date once that client does move into an apartment. We will teach you how to do that in ESG 301 through interim updates. For now, we're saying the client did not move into the apartment yet. They're still looking, and we can click Save. If this was an individual, you could click Save and Exit, and the intake would be complete. But because this is a family, I just have to go and I have to do the ESG entry assessment on the other members. So I'm going to switch to the child again, like we did earlier. And I'm going to scroll down to the ESG program data elements section. Not everything needs to be completed for children. Again, reference your cheat sheet on which questions need to be answered for which client type. I do not need to answer income or benefit questions on children, but I do need to answer health insurance and disability type. So, does this child have any health insurance? I'm going to say the child is on access along with their mother. And I do have to do HUD verification for children as well. So I will say no to everything, but change Medicaid or access to a yes and save and exit. And then, does this client have any reported disabilities? Well, we said this child did not have any disabilities, so I use my HUD verification, mark all the types as no, and save and exit. I do not have to answer any of the education or domestic violence questions on children, but I do need to answer if they've moved into their permanent housing yet, and that is a no. You would continue to do this for every person in the family, and once everyone's assessments are complete, you can click Save and Exit in the bottom right corner. When you click Save and Exit, you will be redirected back to your Entry Exit tab and the preview pane, which shows you the entry into your project, the date of that entry, and the clients. And you can click on this icon and it'll give you their names and the dates of entry. Now let's go back to the Client Profile tab so I can show you that once you complete an assessment and save it, this Client Demographics section auto-populates with the data from the assessment. Now you have completed an entry into the project for your new client or family. The next thing I will show you is how to complete the exit. Obviously, a lot happens between entry and exit. Updates to the record and services will be recorded, and we will show you that in the following videos, ESG 301 and ESG 302. But for this video, the final thing to show you is the exit. So let's say a few months go by, the client is in the apartment, they've stabilized, and they're going to exit from the project. I realize that this may take more than just a couple of months for a client to stabilize, but just for demonstration purposes, let's use a couple of months. So first thing I need to do is I need to get out of backdate mode because I'm going to create an exit now. So I can go up to backdate in the upper right hand corner and I can turn it off by clicking the red X at the end of the date. And now I'm back to today's date. For training today, I'm going to say that the client is exiting today, so I do not need to use backdate mode. However, if the client exited a few days ago and you're just getting around to entering that data, then you should backdate to the day the client actually exited. You would do a client search for your head of household or client that is exiting. And when you exit, please do exit through the head of household. You would go to the Entry Exit tab for that client or head of household, and you would locate the line of entry into your project. Be sure to locate the correct line because some clients will have multiple project entries for other providers that they've sought assistance from. Once you find the line of entry into your project, go to the exit date where it's blank and click on the Edit Exit pencil icon to start the exit process. If you're working with a family, everyone who is in the project will be listed, and be sure to check mark everyone who is leaving. Don't accidentally leave the children behind in the project. Ensure your exit date is correct, and then fill in the reason for leaving. Did they complete the program? Was there criminal activity or violence, death, disagreement with rules or persons, diverted from homeless services, left for a housing opportunity before completing program, needs could not be met, non-compliance with program, non-payment of rent, other, reached maximum time allowed, or the client disappeared. We're going to say they completed the program because they moved into an apartment and stabilized. Then we have destination. This is pretty much the same list as residents prior to entry that we looked at before, but I will point out a few differences. They've added deceased in case the client died while in project. They've added moved from one HOPWA funded project to HOPWA PH, permanent housing. Moved from one HOPWA funded project to HOPWA TH, transitional housing. And HOPWA stands for Housing Opportunities for Persons with AIDS. They've also added a staying or living with family, permanent or temporary, staying or living with friends, permanent or temporary, and a no exit interview completed in case the client disappears. So let's say it's a rental with no ongoing subsidy because they're entering rapid rehousing and they will be paying the rent on their own now. Choose your destination carefully because destination is an outcome measure for many reports. Click Save and Continue. When you do so, an exit assessment will populate so that you can make any last-minute changes to the client's information you may need to make. Do not end income or benefits unless those income or benefits have actually stopped. Leave them open if the client still is receiving them as of the exit date. And if changes need to be made for other household members, you can switch to the other names on the list. Once everyone's data is updated as of the exit date, scroll to the bottom, and there are some housing assessment at exit questions that have to be answered for everyone in the household if this is a homeless prevention project. If this is rapid rehousing, you can leave them blank and be done. But if this is homeless prevention, you should answer these questions. So it's basically asking, was the client able to maintain the housing they had at project entry, or did they have to move to another location? And then if they maintained the housing they had, is it with a subsidy or not? Or if they moved to another location, is it with a subsidy or not? They're pretty self-explanatory. But because my demonstration today is rapid rehousing, I can leave these blank and just save and exit. And now my client, I'm back on the preview pane and you can see my client has an entry date and an exit date. And I can check to be sure I exited everyone in the family by clicking the client count and ensuring that everyone has an entry date and an exit date. Let's go back to our home screen. And that is ESG 300 training, entry, exit, and the ESG assessment. Now let's go over a summary to go over some key points we learned today so that you can do well on your quiz. I just need to move it over onto my screen. There it is. Okay. Number 1. According to the Maricopa HMIS Data Quality Plan, you must enter clients into the system within 5 business days. 2. The U.S. military veteran question is initially answered on the client search screen, but it can also be answered on the client profile screen. Number 3. When creating a household, you must go through the Households tab. Number 4. There can only be one person designated as the head of household. Number 5. When creating an entry, you must go through the Entry/Exit tab. Number 6. Client demographic information should always be recorded on the Entry/Exit tab through the Maricopa UDE assessment. Number 7. HUD considers zip code of last permanent address to be where the client was housed for 90 days or more. And then remember these key points when completing the length of time on streets, in an emergency shelter, or safe haven section. Only answer yes to the first question when the client is entering your project directly from the streets, an emergency shelter, or a safe haven. The exception is if they were in an institutional setting for less than 90 days and came from one of those 3 locations just before being institutionalized. When entering the date of the client's current episode of when the client's current episode of homelessness started, you may use their current entry, quote, day into your project if they cannot remember the exact day. For example, if their entry into your project was October 3rd, 2015, but they only remember their last episode of homelessness starting in May sometime, then you can put the approximate start date of May 3rd, 2015. Count the number of times the client has been homeless in the past 3 years, even if they are not entering your project directly from the streets, emergency shelter, or safe haven. Only use the never in the past 3 years for diversion or homeless prevention, because the question says to include today as one of the episodes. And finally, add up the accumulated months of homelessness during the past 3 years, where the client was either living in the streets, in an emergency shelter, or a safe haven. Remember, any single day or even part of a month counts as one full month for this question. Number 9, if a client enters with no income, put a 0 in the total monthly income text field. Don't leave it blank. Number 10, remember all the federal partners must use the HUD verification workflow in HMIS. This includes ESG. Number 11, in the state of Arizona, access is considered Medicaid. Number 12, when creating an exit, be sure to go through the Entry/Exit tab and use the Edit Exit pencil icon to exit your client or your family from your project. And number 13, when working with homeless prevention, a client or family, be sure to answer the housing assessment at exit questions on everyone in the household. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmis support@cir.org or by phone or text at 602-908-3605. Thank you, and please refer back to your training confirmation email for further instructions.